Facial artery, it is the branch of external carotid artery. Okay, it is the branch from the external carotid artery at the level of the greater cornu of hyoid bone. From here, it consists of two parts, that is facial part and a cervical part. So cervical part situated in the neck winds around the submandibular gland. You can see this is the submandibular gland, winds around the submandibular gland, enter into the face. From here the facial artery in face starts, that is it enters into the face winding around the base of the mandible, runs upwards in a tortuous manner, reaches 1.2 centimeter from the angle of the mouth and runs upwards and reaches at the medial angle of the eye, where it anastomoses with the dorsal nasal artery, which is the branch of ophthalmic. So there is the anastomosis between the external carotid and internal carotid arteries. So this is the course. So it arises, enter into the face by winding around the base of the mandible, runs upwards in a tortuous manner, reaches 1.25 centimeter lateral to the angle of the mouth, runs upwards, ends at the angle of the eye, medial angle of the eye, by anastomosis with dorsal nasal artery. Okay. Branches you can see. Here it is, one it is upper label, superior labi. Here it is, one it is, this is the branch, this is the inferior labi branch. You can see it clearly. So this is inferior labi branch, superior labi branch, and there is a lateral nasal branch. These are the branches in the face. Okay, that is the facial artery. Now we can see the facial vein. So what is the venous drainage of the face? Here it is supratrochlear and supraorbital vein joins to form an angular vein. This angular vein comes down continuous as the facial vein, and then here at the inferior apex of the parotid gland, the retromandibular, the anterior division of retromandibular joins with the facial to form the common facial, which ultimately drain into the internal jugular vein. Okay. So the posterior division along with the posterior auricular vein joins to form the external jugular, which is drains into the subclavian vein. So that is the venous drainage of the face. Clear?